Over the past year, the American Hospital Association and National Association of County and City Health Officials, or NACHO, have worked together with CDC to support and identify community-based collaboratives in which health systems, local health departments, and local partners are making a real difference in advancing health and well-being for all through collaborative assessment and improvement planning. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, senior writer for AHA. It's widely accepted that meaningful work towards healthy communities requires coordinated efforts between healthcare delivery, public health, and diverse community-based organizations. Today, Nancy Myers, AHA's Vice President of Leadership and System Innovation, leads a discussion surrounding the results of these community-based collaboratives. Let's join her now.
Thanks, Tom. I'm Nancy Myers, the Vice President for Leadership and System Innovation at the American Hospital Association, and I'm happy to welcome you to today's discussion. It's widely accepted that working meaningfully toward healthy communities requires coordinated efforts between healthcare delivery, public health, and diverse community-based organizations. Over the last year, the American Hospital Association and the National Association of County and City Health Officials have worked together with CDC support to identify community-based collaboratives in which health systems, local health departments, and local partners are making a real difference in advancing health and well-being for all through collaborative assessment and improvement planning. Today, we're going to speak with two healthcare leaders who have shepherded these collaboratives, including with local public health departments, their local hospitals and health systems, and community-based organizations in their local geography. I'm joined today by three colleagues who I will have introduce themselves, and then we'll get started with discussion.
Thanks, Nancy. Hello, everyone. My name is Peter Holgrave. I'm the Senior Director of what we call our Public Health Infrastructure and Systems team at the National Association of County and City Health Officials, or NACHO. Quite pleased to be with everyone today and to be a partner on this project.
Thanks so much. My name is Kirsten Creation. I'm the Director of Community Outreach at the Center for Health Affairs. We're a regional hospital association that serves 36 hospitals in 9 counties, and I spend a lot of my time working with our member hospitals on community health needs assessments and convenings that can bring us together with other community partners so that we can work on community health improvement activities.
Hello, I'm Shalene Whitaker. I'm the Senior Vice President for Government Affairs here at the Washington State Hospital Association. At the time when we convened the group of hospitals, I was in charge of community benefit and community health needs assessment policy here at the association.
So one of the first questions that we want to talk about is the motivation behind the types of collaboration that you've both facilitated. Beyond basic compliance with regulatory requirements, what do the individual partners, whether they're the local health departments, the hospitals or health systems, or community partners, really get out of being part of a formal consortium like the ones that you've put together in King County, Washington, or in Cuyahoga County, Ohio? So, Shalene, what are your thoughts on that motivation and that return on investment for partnering?
It's a great question. I think at the fundamental beginnings of the group, I think this is a new requirement around what is a community health needs assessment. And the hospitals were all approaching this as individual hospitals and health systems getting ready to undergo a pretty intense new development of a needs assessment. And so I think from the beginning, there was a lot of thought about how could we do this in a way that elicited these partnerships and where the hospitals didn't have to individually do all of this work on their own. That, I think, was the genesis of it. I think what quickly grew was an understanding of hospitals really wanting to understand more about what each other are doing for community benefits in the region.
Kirsten, from your perspective, what would you add to that?
Thanks, Nancy. So I would say in Cuyahoga County, there really is a strong desire among our partners to ensure that all individuals have an equal opportunity to be healthy. This really, I think, brings partners to the table and helps to keep them there. And also a shared motivation also sprang, I think, from the data from previous community health assessments, which show a very clear link between where someone lives in terms of their zip code and their health outcomes. So highlighting health disparities in the data, having a call to action was really spearheaded at the time by the Cuyahoga County Board of Health as the backbone organization, and then also the early work of HIP Cuyahoga co-chairs. And I think that, what folks really get out of being in a formal consortium is strength in terms of numbers and opportunities for new partnerships to develop so that we can help to increase our collective impact.
The one thing that I would add to that is that the networking that happens in these groups, you have a group of individuals who all are performing similar duties within the hospital and are all very passionate about it. And so the natural relationships that are formed within these groups, I think, has a draw that goes beyond the individual groups' work, like the King County Hospitals for a Healthier Community work. So that was really exciting to see when we started convening.
So, Kirsten, in terms of Cuyahoga County, in addition to the hospitals and health systems, being motivated to come to the table, you also have a strong presence from local public health folks as well as other community agencies and service providers. From their perspective, from the non-hospital folks' perspective, what's brought them to the table over the last few years?
I would say that all of the partners outside of the hospital ones, but as including the hospital partners, I think there's just a general, recognition that we've been working in silos for a long time, and we really haven't seen the outcomes that any of us have been hoping to achieve. So I think there's just been a growing recognition that we need to do business differently if we really want to try to move the needle. And I think that there had been a strong desire to try and work with the hospitals over time. And I think that public health partners in our region really did a nice job of using the health assessment that they had done years ago to try and push for this better alignment of clinical and public health.
I'd like to bring Peter into the conversation now and give him a chance to weigh in as well as to ask a few questions along the way. Peter?
Thanks, Nancy. Great discussion. I'm just wondering from your descriptions of your partnerships, if you both could tell us more about the counties or the populations that you serve. And so maybe I'd like to start with Shalene first and ask, how would you describe the populations that you serve, realizing that there might be some overlap or differences across your partnerships? And what are the conditions that you feel like made it beneficial for you to come together to work together? Were there any economic conditions or factors? Was there any kind of a health or population health crisis that occurred, or a grant opportunity that helped to really create some of the elements that really helped to foster these relationships?
Yeah, great question, Peter. So I think just taking a look at when the group first came together, the individual hospitals were thinking about how to complete this community health needs assessment and how to ensure that it's done in a way that meets the IRS standards. And there were certain pieces that the hospitals needed to be able to do, which was interview community groups, look at the data that is in their service area, but also kind of in the region to better understand what the needs are in the community. And public health brought this lens of, they have the data. They often convene those groups that the hospitals were needing to interview. And it kind of coalesced around this idea that we could all do this together and not duplicate resources. The other piece that I think was interesting about this was that some of these hospitals have overlapping service areas in terms of the patients and the communities they serve, but there were hospitals that also were a little bit outside of the downtown Seattle area that had different kind of service areas, and they saw similar needs in their community but weren't exactly the same. So I think there was a lot of coming together and trying to understand what the data told us. King County is a diverse county, and it's clear that there are areas where socioeconomic status is less than in other areas of the county. And so what strategies were being deployed, and how could the group think about reaching populations that they hadn't otherwise reached in their previous community needs assessment and strategies?
Great, I appreciate that. And I'm wondering what's the same for you, Kirsten. So in Cuyahoga County, to what extent are there overlaps and differences in the populations that the hospital system serve versus the local health department and the other community partners at the table? And in what way was that an advantage or disadvantage? And what were some of the other factors? So we just heard of wanting to really better understand the health needs of the community, whether there were overlapping service areas from Shalene's perspective. How does that match with your experience and that of your coalition?
I think Ohio is a little bit unusual in that we had some state regulatory language that came down that really helped to encourage the hospitals and the public health departments to work together, particularly on the community health needs assessments and improvement strategies. So typically the health departments had been on a 5-year time frame compared to the hospital's 3-year time frame. But by 2020, across the state of Ohio, all of the hospitals and health departments are really meant to be working together on this 3-year time frame. And that really, in addition to some of the sort of ground setting work that HIP Cuyahoga had done to try and better link clinical and public health, it really helped to encourage the hospitals to take a look a little bit differently at what their service areas were and how they were defining them. So we had many hospitals that defined their service areas differently, that often included a conglomeration of different zip codes. But I think the combination of the HIP Cuyahoga push to get us to work collaboratively on assessments coupled with the state regulatory language that pushed us to a 3-year time frame, many of the hospitals, in fact, most of the hospitals in Cuyahoga County are now defining their service area to be a county. So that really enabled a lot of the work here in Cuyahoga County in terms of collaboration. And I think it also speaks to locally, we have the will of a group of very strong and committed leaders. Definitely had the buy-in of public health leaders from our local health departments, which was, I think, critical to our early success. The strong backbone organization that the Cuyahoga County Board of Health provided was also very important. And I think that this group of individuals really helped push this narrative that while we have these incredible world-class healthcare institutions, when you really take a look at the data, it's very clear that not everyone in Cuyahoga County has a fair opportunity to be healthy, as evidenced by our health outcomes. So out of 88 counties in Ohio, for example, we rank about 60th according to county health rankings. And on many measures of health, we're really struggling. We rate really poorly in terms of infant mortality rate in Cuyahoga County. It's actually among the highest in the nation, and our numbers are really concerning for African American babies.
Thanks for that. I just have a quick follow-up question. So staying with you, Kirsten, I'm wondering, have you already begun to see some of the successes that it sounds like you're hoping for? So doing a coordinated community health needs assessment and child CHIP process with the local health department, for example, has it kind of resulted in what you were hoping for in terms of efficiency or quality between combining the staff and all those interested parties?
Actually, we're very excited, and things are actually moving at a really fast pace here recently. So we've submitted for a couple of grant applications that we're hoping we're going to be successful in receiving that will help us with some of our work around community engagement that we are all committed to. And recently, very recently, in fact, we've had a lot of interest among our members in taking a look at whether we might be able to move towards a common community referral platform. So that's a conversation that I think I really don't know if that would have been possible without the trust that we've built, at least among our hospital folks, and now we're increasingly bringing the federally qualified health centers to the table, and then also we'll be pulling in the community-based organizations and community members. So I think that it's been a ton of work around trust building, and I think it's really, really starting to pay off, and I think the work around community health improvement is really going to start accelerating in terms of these relationships that we've built.
Fantastic. And how about for you, Shalene? Have you begun to see any benefits through this coordinated action together?
So the group has now put out, I believe, 2 community health needs assessments. And I think what we saw in the conversations were the sharing of strategies to engage groups where the health outcomes are more poor compared to others in the county. So how could the hospital start working more with schools? Healthy eating and education around that was a focus for the group for a while. I think in terms of whether or not we're moving the needle, that will, I think, take some time. And the hospitals are all very serious and committed to, ensuring that they are providing the necessary and community benefits to improve health.
If I could jump in here, this is Nancy again, and I'd like to ask Kirsten in follow-up to what you were just talking about with the work going on in Cuyahoga County. How is it that that diverse group of folks came together and figured out, of all the wonderful things that they could and should be working on, what they were going to start with, and how have they begun to move down that pathway towards coordinated action around some shared vision or goals?
I think that we are really at kind of the beginning stages of this. So we're kind of just beginning to see how this might take shape in Cuyahoga County. I think that it's always helpful to have the framework of the, 5 priorities that came out of the combined assessment. So we've got some really big things that we're planning to tackle. And some of them are carryovers from things that the previous public health assessment had started to work on. So things around eliminating structural racism, that is a big priority topic. And there's a lot of great work that's already happened and that has been happening in the past that will continue to progress forward. I think in terms of how we select the types of things that we're going to be working on, we're actually planning a couple of meetings that are going to involve many of our stakeholders, including community residents, over the next couple of months. And we're going to be talking about which types of aligned strategies should we all be paying attention to and should we focus our energy on. And I think sometimes these conversations and the things you end up working on happen based on conversations that have started in the community sort of just organically. Like I would say here in Cuyahoga County, I mentioned that there's this recent conversation around a shared data platform, and if we might be able to find one uniform electronic platform for community referrals. So that's a really recent conversation, and I think it really stemmed out of the fact that there were a couple of health systems in Cuyahoga County that were really looking to take some action, and then a recognition by some of our other partners that, this might be challenging on the community-based organization side if there are multiple platforms that different hospitals and health systems select, just that process might get really challenging. So that created a conversation of could we bring people together and convene them to talk about if there might be a uniform solution. So that kind of came about sort of organically. And that's probably the best example we have so far of something that we're already taking steps to take a look at.
Great. Thanks for that. Peter, I'll turn it back to you.
Great. Shalene, I'm wondering, I want to start with you about realizing that for both of you, it sounds like you're pretty early in the development of these coordinated activities. You're already beginning to describe some opportunities for collaboration in the future based upon your shared assessment and planning activities, which is just really great to hear. I'm wondering, starting with you, if you've already kind of gleaned some lessons learned, maybe would you have approached different partners differently now in hindsight? Are there others that you felt like would have been great to bring to the table sooner than later? Those kind of issues. So what are some lessons learned, maybe trial by error, for example, in developing or participating in a consortia for King County that you feel like would be important to share with others who are trying to develop their own partnerships in a similar way?
I think my advice for folks starting out on this journey would be to really sit down before you get the hospitals in the room, to really sit down with public health or your other stakeholders and really figure out what's driving them and how they're viewing the world. I think while we worked through some of these potential challenges at the beginning of our group, I think for a while there we were maybe not as focused on what we were trying to accomplish and what would have been seen as success for the group. So I think that's something that I would have done a little differently as kind of convening the group initially. I didn't properly assess kind of the different worlds that we were operating in and the silos that had existed.
Kirsten, I'm wondering about you. Does this resonate with you? And in addition to the external stakeholders that Shalene is describing, I'm also wondering if there were any internal ones, colleagues or folks within your organization that were hard to convince that this was a valuable opportunity to partner in this way.
I think that this type of convening work, we have always done a lot of convening work in terms of our role at the Center for Health Affairs. I think that convening in this way with lots of different partners outside of hospitals probably was a little bit new at the start. We're a regional hospital association. We serve hospitals. So in terms of community health, sort of building the case that in order to do community health improvement work effectively, you really have to be working collaboratively with other partners. I think that was sort of a newer conversation, but we definitely had from the start in terms of our organization internal support for doing that. But I think a lot of folks were kind of watching, let's see how this goes. This is different, different way of doing business. And sort of to add to what Shalene said, we spent a lot of time sort of managing expectations and paying attention to what are often or initially were, I think, competing agendas, and really spent the time to sort those types of conversations out, and being transparent, I think, was really important. It's very cliche to say, but it's totally true, at least in terms of the collaborative work that we do here in Cuyahoga County. Trust is everything moves at the speed of trust. A lot of this work started about 10 years ago, and it takes a while to build real and authentic relationships with folks and to build that trust. There are things that have happened between different sectors here that have, over the years, frayed away at that trust, and I think we've been helping to kind of rebuild some of the things that have happened over the years, and I think we're at a good place now. We found, in terms of bringing folks together, something that for us has been very helpful and we're continuing to use in different convenings is we actually use a set of partnership rules, and that's been really helpful to ground and remind everyone at each meeting about how we kind of work together. This is a different way of doing business, and we use ones that Common Health Action had shared with us. So they include things like respectful listening, respectful talking, being grateful, confidentiality, and assuming good intentions. And there's a few others, but those have been actually really helpful in our convenings that we've been able to do.
That's great, and it makes me think to ask you, Shalene, are there tools or resources or techniques that you felt like, so far anyway, have been really successful in trying to really advance these partnerships to focus on these shared priorities?
I think the intent piece is a really important one. That I think when we really saw the group starting to make progress was that the shared vision became something that people bought into, and then the intent was always going back to what are our communities needing, and how are we here to help serve them. So I think that grounding just became a lot more clear in our discussion. And I think the other piece that really assisted in that was the trust piece, to get the work done that the group was setting out to do. So as we saw the group making progress on looking at the data and talking about community outreach they were doing on certain programs, the excitement grew and kind of built, the momentum built on itself. So that was very exciting to see in the group. But it does take time, and there's going to always be that kind of initial forming part of the process that I think occurs for a reason, and that trust does come out of it. So trusting that process is important.
Yeah, and realizing and honoring what you're saying about the challenges and the amount of effort it takes to develop and cultivate these partnerships. I'm now wondering, I would love to get both of your opinions on where do you kind of see these consortia going into the future? So in King County, for example, to start with you, Shalene, you've described that there can be changes. Maybe there's shifts in vision. Maybe there's differences in the members that make up the group. And I'm wondering, between those kind of changes and maybe as your group works together more closely, are you hoping or already anticipating that you're going to be changing in terms of how you work together? Will you be focusing on more granular populations or topic issues? Do you see that Kirsten had mentioned about really wanting to eliminate structural racism? Do you see that the group is really beginning to focus more intently on addressing the social and structural determinants of health? So if you can kind of describe where your forecast is for the consortium and your hope for the future for the consortium, that would be great.
I think the group has a fundamental good basis in working together now. I think the challenge that any group like that is going to have is that there are staff turnover, there are priorities that change, and so how can the group continue to ensure that they're working together to be able to look at what are the top needs of their community and what are the strategies to address them. I think one of the pieces that the group really felt was really big need was mental health. So how do they work together on providing services for mental health? I think at some point some of those become individual decisions of the hospitals and the services they're providing for their communities. Yet I think the strength of that group is that they all feel like they're kind of in the same boat, that they're identifying these needs that are being unmet in the community and how could they begin addressing them. So I think turnover of staff and potentially ensuring that people are continuing to engage is definitely something that is important. And I think that King County Public Health is really taking the lead on doing that work. And so that's really important to keep this group together.
Yeah, and the way you describe the challenges, though, and what to look out for as the group evolves, though, is really helpful. So for you, Kirsten, I just want to turn to you now. How do you see your consortium evolving over time, whether in terms of the priorities that y'all were focused on or in terms of how you see the composition of the group changing? You know, for example, we often hear the local health departments increasingly are forging partnerships with what I would call formerly non-traditional partners. So whether it's the employment sector or transportation or housing, are you seeing similar shifts within your own consortia for the future? And what kind of areas of focus do you feel like you're evolving towards or focusing on?
So it's a great question. This one caused me to really pause for a moment and try and take out my crystal ball and think about what the future might look like. We're very excited to be where we are today because this was sort of a dream from years ago that we would be at the point that we're at today. So I think at this point in time, based on everything I know, my best guess is that I think we'll be continuing to address the health challenges that are in front of us that we know from our community health needs assessment, and we'll be continuing to develop programming. But I also think that there's a real opportunity to engage policymakers and to begin advocating for policies that can help lead to improved health. I'm really interested to see how that might evolve over time. That's something we've talked about, but I think we'll know a lot more about the interest and appetite for that over the next year as we have those conversations with all of the different partners. And we know that some of the stuff happening in the hospital world in terms of moving away from volume-based care to more value-based care really will necessitate ensuring that patient needs are addressed once a patient leaves the hospital. So I think we'll continue to see these what you mentioned, these non-traditional partners coming together to try to address the needs of the whole person and even move very far upstream, taking a look at maybe tackling some of the social determinants of health. I think that's going to continue to accelerate. I don't really know what form that's going to take. I think that there's some interesting conversations we've begun to have with banks, which if you would have told me a couple years ago that I'd be sitting down with some banks and talking about how we might work together, I would have said that sounds a little crazy. I don't really see the connection, but that's another conversation that we've started to have locally based on the Community Reinvestment Act obligations that the banks have. So there could be some interesting and innovative ways we might be able to work with the banking community. And I think that the data is going to continue to be important to help us track our progress. We're actually getting ready to launch a Healthy Northeast Ohio website here pretty soon that's going to provide a public-facing and publicly accessible platform where everyone can see how we are faring in terms of our health outcomes. So that, I think, will be interesting, and we'll be promoting that out in the community, and it'll be interesting to see what new partners come to the table. I think that there's always new and interesting partnerships that form. Sometimes they seem almost out of the blue, but I think that there's just a huge amount of possibilities when you have so many people committed to this same vision of trying to achieve equity.
Thank you for that. Now let me turn it back over to you, Nancy, for any additional questions and to wrap up today's conversation.
Well, thank you all for your work in your communities every day. You know, the American Hospital Association and NACCHO are both very committed to working individually as well as on projects like these together to really help forge the pathway for hospitals, health systems, health departments, and community service organizations to come together to improve health of each and every American. And so we appreciate the efforts of all of you who are listening in as we have our conversation today and as we're wrapping it up. And again, thank you, Kirsten and Shalene, for sharing the stories of your communities. I think I'll conclude by saying my favorite quote of the day, Kirsten, I'm going to attribute it to you, is that everything moves at the speed of trust. I think that's a message we can all take home to our lives and to our workplaces each and every day. So again, thank you very much. And that concludes our podcast for today.